I want the best doctor in this hospital here, now.
We are sort of a unique show in the medical world.
What seems to be the problem?
There's many, many medical shows that have been on TV, and there are many that are on right now. And we are different than all of them in that we are a show about a diagnostician, someone who sees patients that have already been through somewhat of a medical workup. They've been to smart doctors who've done what smart doctors do, and there's still questions to be answered.
I've been to 16 doctors in the last 2 years.
So Dr. House sort of takes over at the point where traditional means of investigation have exhausted themselves.
I had 3 full-body CTs and 2 MRIs.
And all that was missing was the threat of violence.
What's missing is an answer.
So our diseases unfold in ways that are atypical.
You're telling me I could have breast cancer? Somewhere not in my breast?
House's actions may not be what the average doctor does. So that gives us a broad leeway in dealing with disease progression and the things that 99% wouldn't happen. In our show, that is what we're looking for, because we are about the 1 in a million.
Open your mouth. Relax. You've had it before.
I am not. Milk. Ew.
We'll cut out your mom's tumor and start her on chemo. All the rest of your symptoms should go away.
All the writers on our show work very hard and do a lot of research on their own, coming up with ideas and learning about the diseases which they are interested in and the different ways that those diseases could present and all the things that could go wrong with someone who has a certain disease. It takes a ton of work and a ton of background to form a full episode of the show. So there's sort of no end to how much you can learn about diseases.
You go home last night?
I meant to. Started reading this file, just couldn't put it down.
It's bad for humanity, but it's great for our show that the body breaks down in so many different ways. When we did the second episode of this show, and I swore at the end of that episode, I told every story there was. Every fact I knew was in that script. There was nothing left. I was done. I was empty. Now we're 110 episodes later, and we're still coming up with this stuff. So I have a lot of faith that that reservoir is deep.
Gotta love this family.
There are many different ways to come up with an episode, and over the course of 5 seasons, we've used them all. Episodes always start with some interesting kernel that the writer is really interested in, has caught the writer's attention. That can be many different things. One story that I did this year, there was an article in the newspaper about a man from Russia who learned in his 70s that his parents had put pins in his head to try and kill him when he was a baby.
Push them through the soft fontanelle of an infant. You skewer the brain, and the hair hides the entry wounds. It's the perfect crime.
Then I started backwards and said, well, what were some of the symptoms that these people had that then they realized, oh, this is this is where it was coming from, and built in a structure of a story that built to that moment.
We're all screwed up by our parents. She's got documentation.
Here, Cuddy started with the cat in a nursing home that predicted people's deaths. Peter Blake, who wrote that episode, thought this was a fascinating sort of beginning of a conundrum for the show.
It's like Debbie's here on Earth to bring people to the other side.
Is this real? Could this be real? What is the cat doing? And there were all these theories on what the cat was sensing and how the cat could do this, and was the cat really clairvoyant?
I was right. The cat was not predicting deaths. It was just trying to keep warm.
That's a story that went the other way, that started at the sort of beginning of, well, here's this situation at the beginning, how does it unfold? And with Birthmarks, we sort of started at the end and said, here's the reveal, how do we get there?
Congrats. Because of your crazy obsession with this cat, you've solved a completely trivial mystery.
Completely trivial? My God. It's clearly only partially trivial.
What we will do in an episode is we'll list all the things that could happen on a whiteboard, and then we will pick off of that list things in an order that sort of builds the drama and the tension over the course of the episode. Rarely will we do a story where everything that happened in that story is what happened to one person. It's usually an amalgam of what's happened to multiple people over time.
Whatever he has, she has too. She's sleepwalking.
We do have 2 brains, how the facts stack up and how do we make it entertaining. And hopefully the 2 work together, that the facts provide us opportunities to be amusing and funny and entertaining. And part of it is just, House is such a wonderful character that he can be funny with just about anything.
If he doesn't have that from this, the culture scene will kill him.
Boy, sure hope I'm right.
Accuracy is very important to us. David Shore and Katie Jacobs both stress that things have to be accurate. And when I'm there on set, I'm really looking at, well, does this look like what it looks like in my experience in real life?
How long is it going to take?
Well, assuming he doesn't crash, maybe a few minutes.
Our props people and our set dressers and our makeup people, our wardrobe people. Everyone is so concerned about getting things right and making things look real. Does this rash look like the rash would really look like? Is this how one would hold a scalpel? Where do you need to be sterile? What can I touch? What can't I touch in the operating room? What instruments would be on the tray? Each episode, we have meetings to talk about these very questions and make sure that we get them right.
He needs abdominal surgery to remove a bezoar.
The actors on our show are very, very concerned that they look and sound like real doctors and real medical people. And part of that is pronouncing these words that no one ever would use in conversation unless you were in the medical field.
A cavernous angioma in the brain could leak. Once the blood gets reabsorbed, pressure goes down, symptom goes away.
He'll never consent to petrosal vein sampling.
One of the amazing things about medicine is that even for things that have common names, we've made up complicated names for them. And of course, to sound like doctors, we use the complicated names.
What about Meckel's diverticulum?
So what we do is in the front of each of our scripts, we produce a pronunciation guide that has them spelled phonetically. And then at the start of each episode, I will take a digital tape recorder and record each of those medical words so that on set they can listen to it.
Natalie's liver is continuing to fail and now bradycardia. Atropine isn't keeping the heart rate up. We're gonna have to put her on a pacemaker.
Or once you have the pronunciation down, there's a deeper layer of what am I really saying? Most of our medical dialogue is framed in terms of an argument. I think it's X.
There's nothing structurally wrong with her heart. EKG, echo, electrolyte panel, all normal.
Multiple endocrine syndrome.
Or I see this symptom A and it makes me think X, and you're wrong to say it's Y.
Free T4 is normal. Hypothalamic brain tumor?
That's the deeper level that comes across in the performance of the dialogue.
It's hitting all our organs.
It's a privilege to have so many people interested in what we're doing and to have so many people commenting on our scripts. And frankly, we love to hear what people say and what they think about our shows.
Need an ambulance at 410 Willis.
Whether it's critical or enthusiastic, it's interesting to hear both. I've heard that people have viewing parties and medical students are playing along trying to guess the diagnosis before house.
I'm not gonna fire you every time you get a wrong answer.
And this is great. We love to hear that.
Slight glucose elevation.
You're fired.
It's nice to have people watching what you're doing.